today's speaker. Thank you so much, everyone, for being here.
Oh, thank you, Sam, and good afternoon. My name is Marie Harms, Library Program Director at the State Library, and I'm so happy you're joining us this afternoon as the State Library launches our new initiative to study and assess social work in Iowa public libraries. Social workers have been working in collaboration with libraries for over a decade, and the State Library is interested in exploring opportunities to help more libraries offer these resources to their patrons. I want to recognize and thank Angela Forrett, LRT, here at the State Library for her research and help in getting this project off the ground. The State Library is using American Rescue Act funds for this project and has partnered with Dr. Beth Wahler from the School of Social Work at the University of North Carolina at Charlotte to conduct this needs assessment. Dr. Wahler's primary research interests focus on library patrons' psychosocial needs and how social work can help libraries address these needs. And she has completed needs assessments of other public library systems. Iowa will be her first statewide libraries needs assessment. So thank you, Dr. Wahler, for leading this webinar today to help us launch this very important project.
Thank you for the introduction. Can you give a thumbs up if you can see the PowerPoint? Is it up on the screen? Okay, thank you. So I'm happy to be with all of you today. I appreciate you taking the time to come to this webinar and hear a little bit more about libraries and social workers. I'm going to start out by talking just a little bit more about my experience and why I am in this kind of work to begin with. I will tell you too, my PowerPoint sort of takes up my entire screen, so I'm having trouble seeing the chat at the same time. I do want all of you to be able to put questions in the chat if you have them. There will be time at the end for some question and answers. I've made sure to save some time at the end to respond to questions. But if there's something that needs immediately addressed, if Marie or Angela could help draw my attention to the chat, that would be helpful. So just a little bit about myself. So I am a social worker, and I've been a social worker, and I was in practice for about 14 years, primarily working with people living in poverty who had poverty-related needs or barriers to economic mobility or economic stability. So those things included mental health problems, substance use disorders, learning problems, intimate partner violence, or chronic health problems, anything that could be a barrier to economic stability or economic mobility. So I worked for about 14 years in a variety of roles, and then got my PhD and went into academia. And I used to work in Indiana, so I was in the Midwest. Worked in Indiana for about 10 years at the IU School of Social Work there in a variety of roles in administration, and then also just as a faculty member, and then moved from there here to North Carolina in the fall or late summer to become the director of the School of Social Work here at UNC Charlotte. I sort of fell into public library social work by accident, and it's really been a happy accident for me. I was living in Indianapolis at the time and was working at the IU School of Social Work at the Indianapolis campus. And I was approached by the Indianapolis Public Library, who talked to me a little bit about the things they were experiencing in their library, some of the issues that really were very stressful for the staff and that they were needing some help with. So I partnered with them, and it was largely because of my background in poverty-related needs and working with people living in poverty. I partnered with them for a needs assessment first. We did a needs assessment with staff and then a needs assessment with patrons. And then we piloted students, social work students, in the central branch of the library in Indianapolis. And then we started publishing and presenting on our work. And kept gathering data, and they were able to use the data eventually to hire a full-time social worker this past summer. So they actually have their first on-staff social worker right now. But after we started publishing and presenting on our work in Indianapolis, libraries started coming out of the woodwork. And I really became familiar with the struggles that many libraries were facing all across the country in all different kinds of communities and all different sizes of libraries. So my main research interest for the past several years is now focused on public library patrons' psychosocial needs, library staff's needs as far as trying to meet those kinds of patron needs, and then public library and social work collaborations to meet those patron needs. And then I also run a consulting business that's focused on helping individual libraries do needs assessments of their patrons and staff, pilot different kinds of social work partnerships, and do program development around those kinds of social service programs in libraries, and program evaluation for that. So before I go any further, I want to talk about what I mean by psychosocial needs, because when we see that term in the literature, it means different things depending on who's saying it. What I'm going to mean the rest of this presentation is any psychological or social or environmental factor that is associated with chronic stress and strain and poor health outcomes in general populations. So by psychosocial needs, I mean things like social isolation, mental health problems, substance abuse, poverty-related needs like homelessness or housing instability, food insecurity, difficulty with transportation, and financial needs. So those kinds of things. So in the presentation today, I'm going to be mindful of time. And like I said, I'll save time at the end for questions. But I'm going to talk about some of the recent research on how public libraries' roles have changed due to the growing psychosocial needs of patrons. I'm going to talk about the research on common psychosocial needs that we see in library patrons, how social work partnerships are being used now to complement public library services to help meet patron needs. And then I'm going to end by talking about the goals of the state library project and the process we're going to use to do a needs assessment of the state and how you can get involved. So I want to talk just in general about some of the shifts that have happened in our country that have led to the changes that you all are seeing in the patrons coming in your libraries. So there are a number of historical things that have happened that have impacted public library patrons and who is walking in your doors. The first of those, and really when we look back even further than this, libraries have long shifted and innovated to meet the needs of the society at the time and their local communities. But there are some significant events that have happened that have led to some big changes. One is deinstitutionalization, which was a movement that started in the 60s to get people who had mental health problems out of institutions and back in their communities. So before this time, anybody who was deemed to have some sort of mental health problem or mental illness, which was defined much differently back in the 50s and 60s than it is now. But it wasn't unusual to see people with mental illnesses who were in institutions for their entire adult lives sometimes. And in the 60s, the movement to deinstitutionalize people and get people out in the community started out of this awareness that people don't do well when they're in an institution for a long time. They do better when they're around their own social network, when they can feel like they're contributing to society in some way, when they can really have a much fuller and whole life and not just be in a hospital for years. So with this movement came federal funds to try to have mental health services offered in communities across the country. The funds have never been enough to meet the needs, and we're going to look at that in a few minutes. The funds have never been enough to meet the mental health needs or to address the other kinds of needs that people with chronic and persistent mental illnesses have, people who often aren't able to sustain a job with a living wage, or who have other kinds of issues that are interfering with their ability to really support themselves over time. They need more community supports than what the funds that are available really provide. We also, so that led to a change in what libraries are seeing, because you started seeing an increase in people experiencing homelessness and people experiencing chronic and persistent mental illnesses who were looking for public places to be, like libraries. The Great Recession and the mortgage crisis of 2007 to 2009 also brought about a significant increase in people who were experiencing poverty-related challenges in the US. There's long been a shortage of emergency shelter beds for people who are experiencing homelessness or people who are experiencing intimate partner violence or anything else that might require them to need emergency shelter. We, over the past few decades, have continued to see inflation and increasing costs, but wages have been stagnant. So minimum wage has remained $7.25 an hour since 2009. And for Iowa, the estimated current living wage in your state for a single person with zero dependents is $13.62 an hour, almost double what the minimum wage is. So we see people who, more and more people who just can't afford the expenses that it takes to live. They need assistance, and that's why they're coming to libraries. We also have seen an increase in statutes that have been passed across the country that criminalize homelessness. So there have been increasing laws that prevent people from loitering or arrest them for loitering or panhandling. There's been an increase in what we call hostile architecture, where people find fewer places to even rest or sit down unless they are going somewhere like a library where they can rest comfortably. So that has also led to an increase in people who are experiencing homelessness coming into public libraries. And then now COVID. Over the past 2 years with the pandemic, we've seen an increase in poverty-related needs, an increase in mental health problems, an increase in housing instability, lots of additional challenges brought about by the pandemic that are only expected to continue to increase over these next few years. In Iowa specifically, there are a number of factors that again impact the public, and they impact who is coming in your doors in a public library. So in Iowa, there's a lot of difficulty accessing healthcare. There's a lack of access to mental health care, housing insecurity and homelessness, and poverty. So here's a map of Iowa that shows all of the counties that are designated by the federal government as healthcare shortage areas. So it's about half of the state is that pinky sort of color in the map. So all of those counties don't have enough healthcare to meet the needs of the population in those counties. The map is even worse when we look for mental health shortage designation. So almost the entire state of Iowa has a shortage of mental health providers for the population in those areas. Housing instability and homelessness is also a big issue in Iowa. So the annual point-in-time estimate in 2021 found 2,725 individuals who were homeless, and that's a snapshot of how many people are homeless on any given day in the state. These point-in-time estimates are considered to be pretty big underestimates, really, because they don't capture people who might be living on the streets somewhere. They do a better job of capturing people who are in shelter, in services, or who are accessible by the people who are doing these counts. So this number is probably an underestimate for the number of people you have experiencing homelessness on any given day in your state. Just under 12,000 people, and these are unduplicated people, received services in 2019 at housing-focused programs, and they were experiencing homelessness at the time they accessed services. Over 6,000 children in Iowa public schools experienced homelessness during the 19 and 20 academic year. And then that's homelessness. But then when we start looking at people who actually are housed, we also see concerning numbers. So for Iowa residents who actually have housing, over a third of people who are renting and almost 16% of homeowners spend more than 30% of their income on housing costs, which means they're pretty close to potentially being homeless or being unable to afford other things they may need to live because of the amount of their income they're spending on housing. Of low-income Iowa residents in particular, over half pay more than 50% of their income for housing costs. So again, we've got a group of people who may have stable housing, but they have a lot of other poverty-related needs or income-related needs. The state as a whole has about 10.2% of the total population who are living in poverty, and that's at or under the federal poverty rate. And to kind of know where that is, the data that developed this map were from 2019, and the federal poverty rate in 2019 was a family of 4 making $25,750 a year or less. So this is capturing how many people had that low of an income. But again, there's a whole group of people who have a high enough income that they don't get captured in these poverty rates, but they really have a lot of other needs and difficulty affording services or accessing services. And many of them are coming to libraries. And you can see also from this map the different colors. So the blue counties, less than 10% of the population in those counties is at or under that poverty rate. The green counties are between 10 and 14.9% of the citizens in those counties are at or below the poverty rate. The sort of terracotta-ish color is between 15% and 19.9%. And then Story County, right in the middle of the state, has 20% or more at or below that poverty rate. So I wanted to ask you, what kinds of things you're seeing? What are the biggest patron needs you're seeing in your library right now? And I'm going to stop my screen share for just a minute so I can see the chat. So what are you seeing as the biggest unmet needs in your library? Okay, transportation, internet access, definitely. Mental health, food and housing security, refugee and immigrant related needs, tech skills, navigating safety nets, that's a big one. Mental health, mental illness, help filling out forms, that is a common need too that's met by libraries a lot of times. Okay, transportation to jobs. So lots of those poverty related needs that I was talking about, which makes sense for the needs of your state and where we see some of the shortages and some of the unmet need. Okay, I see a few other comments coming in. I also saw a comment at the beginning. I will make sure to share the slides with everybody after this presentation as well. Okay, people who speak little or no English. Okay. So I'm going to share the screen again. Let's see. Okay, so my research has focused quite a bit on the psychosocial needs of patrons in various libraries and library systems in the country. I'm going to share some information in a few minutes that comes from some of my needs assessments, but other research, and it's a relatively new area of research, so there's not a ton out there yet, but we can see from the existing literature that psychosocial needs of patrons have been increasing in recent decades and have continued to increase. The top areas of patron needs that keep showing up in the literature are homelessness or unsafe, unstable housing, mental health challenges, substance use or overdoses, and other poverty-related needs like transportation or food security. We also have a small body of literature that has looked at needs and whether they vary based on housing status, and has found that yes, which makes sense, that if your library is serving a large number of people who are experiencing homelessness, they also are more likely to have some of these other needs, including mental health problems or substance use problems, or just unable to access services that they need in the community. These needs are all expected to continue increasing due to the COVID-19 pandemic. I want to point out, though, that most of the existing research on patron needs has focused on urban or suburban libraries. So there's a lot of work that we still need to do looking at rural or smaller libraries and the prevalence of patron needs in those libraries. So for my own needs assessments, I'm going to share some data about the top areas of unmet need that library patrons have reported. And this information comes from 3 different needs assessments that were done. Most of my patron needs assessments wound up getting put on hold because of the pandemic and with libraries serving a reduced number of patrons. So there are only 3 libraries represented in this, the data I'm getting ready to share with you. They do come from 3 libraries in 2 Midwestern states. And the original methods included surveys that were available and popped up on the library computers for everybody who was using the computer in the library space, paper surveys that were available for patrons in the library, and then 2 out of the 3 libraries also emailed the survey to their full patron email list. So what you see here are the 3 libraries, and they are all from urban or classified as metro areas. So this uses the USDA rural urban continuum codes, and you can see on the right-hand side what the code means for Metro 1, Metro 2, or Metro 3. So Metro 1 was the largest metropolitan area. Metro 3 is a smaller metropolitan area. But the top 5 patron self-reported needs are highlighted here. The middle library has 6 needs highlighted because there was a tie for 5th. So for all 3 libraries, financial needs make it to the top 5, medical and physical health needs make it to the top 5, employment makes it to the top 5. Mental health needs and education and literacy show up in the top 5 needs for 2 out of the 3 libraries. And then transportation, clothing, and social connections show up for just 1 of the libraries as the top 5 unmet patron needs. So pretty consistent with some of what you all were describing that you're seeing in your local libraries too. If you look at the percentage of patrons who reported that, I explained on the previous slide that 2 of these libraries, which actually are the 2nd and the 3rd columns here, sent the list to their email. They sent the survey to their email list. So the first column, those were the unmet needs of only people who are actually using the library space. So the percentages are a little higher. For the libraries that emailed their entire list of email addresses for their patrons, the numbers or percentages of the total sample are a little bit smaller. But with what we know from staff surveys, which I'll talk about in a minute, even small percentages or small numbers of patrons with these really high level needs can cause a lot of stress and strain and can take up a lot of the library staff time as well. So the next thing I'm going to share are the results from some of my library staff needs assessments. So the data I'm going to share come from 7 different libraries in 4 different states. 3 of those states are Midwestern, 1 is in the Eastern US. These are varying community sizes from sort of large metropolitan areas to what's classified as non-metropolitan or a more rural area. And these were electronic surveys of staff that were originally sent by the library administrator for the needs assessment. So again, the top 5 are highlighted, except the last column has 6 because there was a tie again for the top 5. So for all 7 libraries, so the most urban ones are on the left. Those metro ones are the biggest urban areas, going to some smaller metro areas, and you can see on the right-hand side how they're classified. And then that final column is the 1 library that was in this sample that is classified as a non-metro library, but it still had a population of more than 20,000 people that lived in that town and accessed that library. So the top of the top 5 needs for all 7 libraries, we see staff describing patron financial needs, mental health needs, and then 6 out of the 7 libraries described having housing being one of their top unmet needs of their patrons, substance abuse, and then employment is one of the top 5 needs. And then you can see there are some other needs that were outliers for just 1 library system. So social connections and education and literacy show up for just 1 of the libraries, and that's the more rural library in the sample. And then medical and physical health needs show up in the top 5 patron needs as perceived by staff for 2 out of those 7 libraries. We know from all of this, again, it's a newer body of research, but it's a growing body of research, that libraries are really feeling the strain from this shift that's happened with the patron population. Staff in libraries are often not trained or qualified to assist with the levels of need that patrons have. Staff often feel conflicted about their role with these kinds of needs and what exactly are they expected to do to meet these kinds of patron needs, or what is the role of the library. Patrons with these needs do take up more time for staff, which often stretches staff too thin or causes problems with trying to meet other people's needs in the library. And some staff are fearful for their safety or the safety of other patrons due to patron behaviors that are sort of attributed to some of these psychosocial needs. And some libraries are having to call pretty frequently police or security or for some sort of emergency assistance because of things that are happening in the library. There's a study that's being conducted right now looking at library worker trauma. And that study so far, it's not finished, but it has found already that frontline library workers and even some non-frontline library workers from all types of libraries, urban, suburban, and rural, report high rates of trauma from workplace incidents that are happening at the library. Cases of verbal abuse, physical aggression, and attacks from patrons, or threats of violence that are happening. These incidents have only increased since the COVID pandemic began, And some library staff are actually experiencing symptoms of PTSD or experiencing worsening of a pre-existing mental health condition because of things that are being experienced in the workplace. COVID has brought about even more changes, which I've mentioned a few things. One of the needs assessments I did recently looked at COVID-related changes, and staff are reporting less patron interaction overall, more interaction that's focused on just enforcing COVID-related restrictions, addressing more patron mental health challenges, poverty-related needs, and other psychosocial needs, handling more patron-related behavioral issues, and then having to be creative about services provided and providing services through curbside services or creating virtual or remote programming. From other research on burnout, all of these things are contributing factors to secondary trauma that happens on the job and burnout. Anytime that you're experiencing shifts and changes in your job responsibilities, you're having less interactions that are positive or what you got in the job for, and more interactions that are stressful and difficult and troublesome in some way, the more that we put people at risk for burnout. So one thing that's being done across the country and is really increasing is to try to partner social work with public libraries to meet some of these needs, to meet both patron needs and staff needs. There's a growing movement. The model looks very different in different libraries. And it started really over a decade ago in some of the more urban, really unique contexts, very urban libraries. And then over the past couple of years, it's really taken off. And over the last year, it's really exponentially increased in all sizes of libraries across the country. With these collaborations, I want to point out that this does not mean that public libraries are becoming social service organizations. So there are still boundaries drawn about what services the social workers might provide with the library. And the library is still fulfilling its primary mission as a library. And it focuses, if any of you have read the Whole Person Librarianship book, or if you know about the Whole Person Librarianship model, it focuses on a different type of information needs and relationships as the new reference collection. It has made sense conceptually for our disciplines to partner with each other. There are a lot of overlapping professional values between library work and social work. So we all have a commitment to service, to privacy and confidentiality, and protecting privacy of our patrons or our clients. We are dedicated to improving access to accurate information so people can make healthy decisions or the best decisions for themselves. We have a strong respect for individual rights. We emphasize professionalism and acting with integrity and competence. And we, as social workers and public library workers, are dedicated to social justice and advocacy in many ways. We also have a key way that we differ that really complements one another. So for libraries, your mission is about focusing on serving the whole public and addressing the needs of the whole public. For social work, our professional mission is about focusing on the most vulnerable or oppressed in any sort of situation. So this is one way we really complement one another. As I mentioned earlier, in the literature, it's clear that even though patrons with these high-level needs make up a small percentage of the overall patron population that you might have in your library, they take up a disproportionate amount of time and energy, and it causes a lot of stress sometimes with trying to meet the needs of all patrons. And so in libraries where we have a social worker or social work students or a social work unit of some kind, the social worker can really work closely with those high need patrons, and it frees up the library workers' time to better meet the needs of all patrons. So I get asked sometimes, why social work in particular? Why does a library benefit from having a social worker in that space? Why can't these services just be provided by a trained librarian? And in some cases, libraries have attempted to meet some of these psychosocial needs through trained librarians, but there are some differences in how we're trained. And for social workers, all social workers, even social workers who eventually go into some kind of specialized practice, are originally trained to work across what we call the micro to macro continuum of services and in a generalist environment. A generalist environment just means a setting where we might interact with all different populations, all different age groups, all different kinds of issues. So exactly what a public library is. The micro to macro continuum I'm going to talk about in a minute on the next slide. But that means that we are trained to work with individuals. That's what micro means. And we're also trained to work with communities and to identify gaps that exist in communities. That's the macro side of things. So I'll talk about that in just a minute. We are also trained to look for and assess and address the root cause of an issue. So even if somebody's seeking our services because they need referred somewhere in the community, they need referred for food or they need referred for housing, our job and our training prepares us to really look for the underlying issues that might contribute to that. And what can we do that can help move that person a little bit forward with their own, whether it's socioeconomic, mobility or stability, or if it's making progress with a mental health issue, or whatever the need is that they're having. We're trained to look for whatever the underlying issue is that might contribute to that, and then to eventually try to address that issue so that the person doesn't find themselves in the same situation over and over. We're trained also to foster independence. And so even if we're making referrals or sharing resources or connecting people with resources, our training is about being really mindful of things that might create dependence on social services or on some sort of assistance, and to help, again, move people along in their own process to eventually foster independence so that they'll be able to problem solve or take care of some of these things on their own. We're also trained to use clinical skills, even if we're not in a clinical environment. So we're all trained in assessment. We're trained in the stages of change, which that refers to how much somebody's ready to try to change something that's problematic in their life. So we used to talk about people being in denial, for example, with a substance use problem. That's just an earlier stage of change. They're not quite ready to actually go to some sort of treatment right now, but we're trained to identify that and then use motivational interviewing skills or other brief interventions to move people along that change process too, again, with the hope that eventually we'll be able to help get them unstuck from whatever issue it is that's problematic for them. So social workers in the library, some examples of things that we do that fall across that micro to macro continuum of services. Micro level work that social workers do. This is what seems to be getting the most attention, like in the news media right now, but it's working with individual patrons to assess for needs, provide information, make referrals, do that warm handoff or hand holding to help them actually follow through with referrals or navigate some of the systems that are really complicated sometimes. We can do crisis intervention, case management, or individual level advocacy for what somebody needs. On the meso level, which is the in-between level of services, that's working with groups of people. So we can facilitate programming or workshops for patrons in libraries. We can help pull together or facilitate non-clinical or mutual aid support groups, book groups on books that are related to psychosocial needs, or provide staff training sessions. On the macro level of services, we work at the organizational or the community level. So social workers in libraries help to identify gaps in services that are happening in that local community, participate in advisory boards or task forces or different groups that aim to address some of those gaps and find solutions for some of those gaps. We help create mechanisms for increasing the capacity of the library to support patrons with psychosocial needs, or analyze policies which may disproportionately impact one group of people versus another. So these are just some examples of some of the things that social workers do in the library. And most social workers in library settings do a combination of all of these things. Although some libraries have decided that they want a social worker to really focus only on the macro side or more on the micro side of things. So it has depended on the context. Existing models of library-based social services kind of exist along a continuum. So on the left side of the arrow, you've got libraries who have designated personnel and are trying to maintain resource lists or relationships with community partners. The next along the arrow is having community partners actually come in and hold office hours or meet with patrons in the library space. The next level is having social work students who come in the library and might work on time-limited projects during their practicum placement or their internship. And then finally, kind of the end result for many libraries is trying to move along this continuum and hire a library or hire a social worker or have a shared social work position, but somehow have a social worker, a professional level social worker in the space. Here's a map. This is the map that was from today on this website. So again, if you're not familiar with the whole person librarianship, book or their website, they have a lot of resources available for libraries that are interested in how to use social work principles in library work. But this is a map of all the existing known social work library collaborations. This is probably also an underreporting because it depends on the library to self-report their partnership. And there have been a huge number of partnerships popping up over the past few months, over 6 months, over the past year. So you can see here, there are a couple libraries in Iowa who are on the map for having student interns. I do know just, from my own work that Davenport has recently hired a full-time social worker. That position does not show up on this map, but you can see the sort of fuchsia dots are the full-time social worker in a library. Orange dots are somebody from the community coming in and holding office hours in the library space. Green dot is having a part-time social worker in the library, and then the blue dots are the social work practicum students or internships. So just some potential benefits of having a social worker in the library. And this really is this is based off of preliminary data as well. Most of these partnerships are really new, so we haven't been able to do in-depth outcome studies. The social work positions in libraries that have been in place longer are in very unique communities and settings like San Francisco or Denver. Unique libraries where the results, whatever the social worker is doing there, might not necessarily be generalizable to other libraries across the country. But from preliminary data and some early research with library social workers and library administrators where there are social workers, we seem to be seeing that when there's social work in the library, we see increased support for staff wellness with the library staff. We see a reduction in security interactions or calls to police, a reduction in the number of patrons who wind up getting barred from the library, an increase in patron access to community services and sort of prevention of community members falling through the cracks in those communities. We see a development of programming to meet the specific psychosocial needs of library patrons in that area, and increased collaboration between the library and other community organizations that provide social services. Some barriers or challenges that have to be overcome and need to be planned for in advance are things like funding. Usually the biggest question is, how are people paying for these positions? And some of them are grant funded for time, a time limited period, which has its own challenges. And then the library is left trying to figure out how to sustain that after the grant is up. We see some of these partnerships that are developed through, or some of these positions are developed through a partnership or a contract between the library and a community organization that's providing social services that will just have somebody come use the library space. And some of these are being funded through library general funding and existing resources, and libraries that have determined that the need is great enough that they've reallocated funds from somewhere else to pay for one of these social work positions. Another challenge that comes up is liability insurance. So that is something that has to be factored into any budget for one of these positions if the current library policy isn't sufficient, and it usually isn't for social work services. So it's something that has to be considered. Record keeping is sometimes a challenge or a barrier for these positions because of libraries not keeping any sensitive or private information about their patrons, and social workers needing to keep some minimal records about patrons and what they may be working with patrons on. So record keeping has to be worked out, and it's a challenge that has to be dealt with a little differently in each community or each library, depending on the needs of that library. And one of the biggest challenges is that every library is different. Every community is different. Libraries have created services that meet the needs of their specific community. And so when a social worker comes into that library, the services have to be tailored also for the needs of that library. So it makes it difficult because the person's almost always starting from scratch. They might be able to get some guidance from other library social workers and other libraries, but it has to look a little different in each community. And then having supervision for the library social worker and connection to others is a barrier that has to be worked out too, because these positions are oftentimes the only person in the library that is a social worker. And they can be very isolated sometimes. I've talked to several who say they feel like an island. So making sure that you're intentionally working to integrate that person in the library culture as much as possible, and then also making sure that person is connected to the broader library social work network. I want to share some examples of how this is being done in different size communities across the country. So most people know about the large urban libraries. People have heard about San Francisco's program or Denver's or Washington, D.C. In all three of those libraries, we do see the social worker providing services all along that micro to macro continuum. So they're working some with patrons, they're also doing a lot of community level work as well. In all of these libraries, they have teams somehow. So they have peer navigators or peer support. They're supervising students, but that one social worker, in some libraries, there's more than one social worker, but they've used other ways to try to magnify their services. But these, again, are not typical communities. So these libraries are very different than what, a library in most other states looks like. So in some smaller communities, I wanted to highlight those. So in Burbank, California, that's a population of 103,000, which the libraries on this slide are similar to some of the larger cities in Iowa. So I think your largest city is Des Moines, that has a population of 214,000, followed by Cedar Rapids with a population around 138,000, and then Davenport with 102,000. So you want to compare sort of populations, although there still are some key cultural differences with, again, every library in every state. But Burbank has a really unique position that they just added last summer. It's jointly funded by the library and the city's Parks and Rec department, and it's shared between 3 libraries and 2 senior centers. So this social worker rotates between all 5 of those places and mainly focuses on conducting outreach in each of those environments to make people aware that she exists and she can connect them to resources, and to try to just increase the likelihood that people will ask for resources and then she can connect them. Then she meets with individuals and families as needed for assessment and referrals. And she also is focused on connecting the library and developing partnerships with other community organizations there. So that's a really unique situation where they're partnering. There are 2 funders for this position and 5 partners that are all partnering together for this. In Georgetown Public Library in Texas, which is a population of about 71,000, it's a grant-funded position that was originally funded through their state library commission. I think some federal grant funds that were funneled through the state. It has a full-time social worker who focuses on providing assessment and referral to individual patrons, but also works to identify resource gaps. He gathers data about resource gaps. Part of his job description is actually about data collection. And he works with citywide groups to advocate for the expansion of social services when they identify where there's a gap and what's needed. He also serves as a liaison between the city staff and then local nonprofit organizations. Rochester Public Library in Minnesota has a new position. That community is a population of about 115,000. They have a brand new partnership with a local nonprofit organization. So the social worker is actually employed by that partnering organization, but she comes into the library 25 hours a week. She works there's a specific place in the library called the Wellness Corner, and she focuses on support and referrals for people who need connected to resources for housing, food, and other kinds of social services. And she also can do long-term case management as needed. So she can work with somebody as long as they want her to in that position. Some rural libraries have started adding social work positions too. So the first known rural library to add a social worker was Niles Public Library in Michigan. This is a rural library with a population of under 12,000 people. They actually received grant funds to start this as part of a grant-funded project called Social Workers in Rural and Small Libraries. And that social worker partners with some students from a local school of social work to meet with individuals, connect and develop relationships between the library and local service providers, and really has done a lot of work to establish what library social services could look like in a rural area. And then Union County, South Carolina has a really unique arrangement as well. That's a rural area with a population of under 8,000. It's a small library with a staff of about 5, I think. And they wound up, the director had gone to some mental health first aid training, had become really interested in how the library could meet mental health needs of people in that community and then poverty related needs, and decided when the assistant director, sorry, you can tell I work in an academic environment, When the assistant director position was vacant, the director actually made a decision to hire a social worker for that assistant director position. So that person has all the administrative responsibilities that come with that assistant director position and partners with the director on policy related issues, supervising staff. But she also maintains a caseload of patrons for individual assessment, referral, and case management. There was no food pantry in that community at all. So she worked with some other providers in that area and developed and created and maintains a food pantry through the library. And she does other work to try to identify community gaps and look for solutions. So those are some examples of rural libraries that have hired social workers. Lots of libraries right now are adding students, and students are often the first step for a library that's considering social services if a school of social work is nearby. And for many libraries, that's not something they can consider because there aren't any schools close by. But if you are considering students, a couple things to remember are that they are inexpensive, although sometimes you have to pay for supervision for them. It depends on the arrangement with the School of Social Work. And students can do many of the things I mentioned that are working across that micro to macro continuum of services for library patrons and library staff. A couple challenges. There's frequent turnover. So students are usually there for 1 semester or 2 semesters, and you constantly have to orient new students to the library and train them again and wait for them to go through this training period. There sometimes are gaps between student placements. So you might have somebody in the spring and maybe that school doesn't place students again until the following fall, or there could be a year between people. It depends on that school and how things are structured. Students can't operate independently, so there has to be a social work supervisor somehow, and the School of Social Work will partner with you on figuring out who that could be, but that can be a big challenge sometimes. Some schools have specializations that aren't necessarily a good fit for library settings, so you want to make sure that you are accessing students who really are trained for those generalist settings. And again, many libraries just don't have access to students. There's one library I wanted to highlight, or one group of libraries I wanted to highlight here that's using students. So this is sort of an innovative program. It's Allegheny County, Pennsylvania, which is not a rural area. That's right around Pittsburgh. So it's an urban area, but it's a partnership between 46 public libraries that are all independent public libraries and 70 different locations who have formed this Allegheny County Library Association. And they, as a library association, have written a grant and got some funds to provide paid stipends for students and pay for the supervision for students. And as a whole, they've formed this group and this consortium to try to share resources and be able to afford things as a group they couldn't access individually. So I do think as we move forward with these kinds of partnerships across the country, we'll start seeing more partnerships between libraries because lots of libraries don't have the resources on their own to do something like this, but if they can partner or share resources, there may be a way to get some assistance for that area. So I just wanted to highlight this. So just briefly talking about the Iowa Public Libraries Needs Assessment and how you can get involved. The overall goals of this project are to really identify what the psychosocial needs are of patrons in Iowa and to identify gaps in libraries' abilities to meet those needs and what resources might be helpful. We're going to be looking at what staff and library readiness overall for adding a social services component. The end result is to have some recommendations for next steps that the state library could consider to support libraries with these types of needs. And we're going to make sure we distinguish between rural and urban libraries in the report and the recommendations. The first step is a survey of staff. And the second step is going to be focus groups with library directors. So the first stage, we need all of you to participate and for you to forward the link to other people in your library and try to get as much participation as possible so we can have a good snapshot of the needs across the state and how all of you feel about this across the state. This survey is going to be open today on the state library's website. A link will also be emailed to all of you as webinar participants and is going to be sent out to a number of the state libraries' email lists. It's going to take about 20 minutes to take the survey. Again, I hope as many of you as possible take this because it's really important that we hear your voice. Phase 2 is going to be focus groups with library directors, and these are going to be done in every district of the state, looking at specific regions and what models of social work collaborations might work, what are the barriers, what are the concerns, what are the challenges. in each different area of the state. So directors are going to be grouped by library district. You'll get emails about this later on in the summer. These focus groups will happen around May or June. I also am going to be traveling to Iowa to visit multiple public libraries across the state, and I'd like to see a good sample across different districts in rural and urban communities. And that's going to happen sometime in April or May, depending on how the travel can all be arranged. If you are interested in having your library be part of those visits, please contact Angela at the email at the bottom. These are just informal visits where I'm going to talk to you about what you're seeing, but I really want to see your space and just hear from you in an informal way about what some of the challenges are that you're experiencing. So if you have questions, we've got a few minutes for questions now. I've also got my email addresses there. If you have questions and want to send me something after, I'm more than happy to answer any questions for anybody. And I will make sure that this PowerPoint gets sent out to everybody too. So I will turn it over to questions. Oh, good question. So I see one about the survey. So the survey opens today. I skipped over that because of time. And that's an important point. The survey opens today and it will be open for a month. So it's going to be open through, I believe, March 25th, whatever that Friday is. And you'll get a couple reminders too, but you'll have the opportunity to take it for a month starting today. Any other questions? So there's a question about recommendations for grants or funding sources. So the thing to remember is that the funding source sometimes dictates what can and can't be done in that library. So some libraries have sought funding through their local United Way, or there may be a local community foundation that funds initiatives in local parts of the state. Sometimes those are tied to housing or tied to poverty related needs or tied to mental health. So it just sometimes changes what services the person is able to offer. But a lot of libraries are getting grants. So it depends on the state too. So in some states, ARPA funds could be used for this. In other states and areas, it's United Way again, or small private foundations that fund things in that local community. Some libraries have also started with just individual needs assessments, and then they've used that data to make some decisions about their own budgets and writing a position like this into their permanent budget. But those are only libraries that have some flexibility they have enough positions that they could decide to not fill an existing position and instead fill a social worker position. Some libraries that are currently paying for security have used funds that used to be used for security to reduce what they're paying for security and pay for social workers. So it depends. Libraries are funded so differently anyway. Some are through city or county funds, some are private. So it really it looks different depending on the funding sources for that library. Any other questions? So a question about an individual needs assessment. So for those of you who've seen the Whole Person Librarianship book, there's a sample needs assessment in that book as one of the appendices that some libraries have used. The Whole Person Librarianship also has a community of practice, like an email list that you can join. And if you join that list, that's not just for social workers, that is for library staff everywhere. In fact, it's mostly library staff that are part of that list. And people will frequently send out an email and say, does anybody have a needs assessment you can share? And so that's a good way to get some sample needs assessments to see if it's something that would work for you, or if you want to tweak that somehow to meet the needs of your library. But I'd start there, the Whole Person Librarianship website or their book, or joining that email list that they have. So there's a question about currently partnering with outreach workers from other organizations to have office hours in the library, and what did they get out of that partnership, and is the library taking advantage of them? No, their whole mission is to serve as many people as possible. So now it depends on the agency and the organization, but for most organizations, they need to serve as many people as they can. And the library is a great place for them to access community members and serve them. So they wouldn't do it if they felt like you were taking advantage of them. And instead, it's a way for them to fulfill their own mission. Any other questions? So at the end of this project, so the needs assessment with Iowa Public Libraries is going through September. The final report will be given back to the state library in September. And there will be another webinar at that time where I'll share the findings with everyone. So stay tuned, you will get more information and you will be informed of what comes out of this at the end. So I see one more question here. Somebody who has an MSW and was just hired at her city's library, not to do outreach. Okay, rural library, county seat. Do we know any libraries and social workers working with people who have just been released and prison partnerships? Yes. So oh goodness, Long Branch, New Jersey, which again is a very different kind of community. But there's a social worker named David Perez in that office, and his email in that library. His email's online. If you Google David Perez, Library Social Work, New Jersey, you'll find him. But that library has an extensive program that they're doing with people who are coming out of prison to help them re-enter the community as successfully as possible. So I would recommend reaching out to David and the Long Branch, New Jersey library to ask more about what they're doing there. Okay. It looks like our time is about up. I appreciate all of you joining today, and I will send this PowerPoint to Sam, Angela, and Marie and make sure that it gets sent out to all of you.
Thank you very much, Dr. Wahler, for your time this afternoon. We really appreciate it.